Hello, today I'm going to speak about a vision for an inclusive Newfoundland and Labrador. Now, many of these, what I'm going to talk about, could be applied to any community or province, but this is specifically based on a report that myself, as team lead, and various colleagues, many of you recognize their names, um, wrote for a conference paper, a thought report that was based on what would a Newfoundland and Labrador look like if we weren't dependent on oil. And I'd also previously spoken about some of these issues at the 2016 Inclusion Summit that was held in St. John's. I'd like to point out that a lot of this presentation and report was informed by people that we spoke to. So we looked at people with disabilities, people who were people of color, parents of people with disabilities, people from the Empower Disability Resource Center, people from the Coalition of Persons with Disabilities, LGBTQ, Pride organization, etc. So an inclusive province is one where everyone has access to resources, quality community necessities and amenities, it's not just about access, but quality, and equal opportunities to take part in all aspects of community life. There should be a sense of belonging and dignity and respect in the community. It's also important that all forms of discrimination in a province will be responded to quickly, that we will work to eliminate these discriminations, and that all citizens will be interdependent and engaged in decision-making processes that affect their lives, and diversity will be valued and embraced. These are the dimensions of diversity, and they include age, gender, sexual orientation, ethnicity, race and culture, disability and ability, and socioeconomic status. Unfortunately, in our province, we focus here on only a few dimensions, and when it comes to provincial and community development planning. Traditionally, provincial and community planning, social structures and programs have been created by and for the dominant race, class, and gender. In Newfoundland, we have a median age of 44 years, which is quite high, and 16% of our population is 65 years of age or older, and expected to increase. We have a population of 49% is female, and unfortunately, right now, we don't actually have good statistics on how many people would say that they were gender binary or gender neutral. However, that's going to change as Stats Canada is now including that in their census. We also are a mix of European or North American origins, and English is the predominant mother language. 7% of our population is Indigenous, and 1% of the whole province would be identified as people of color. And finally, over 14% of people who are 15 years of age or older identify themselves as having a disability. Wasn't able to get that slide to work properly. I'm sorry if there was a pause there. This was supposed to have a whole bunch of images coming in and out, but it doesn't seem to be working with my recording software. In the 21st century, though, awareness of diversity and the rights of inclusion for all is more widely accepted and should ideally form the foundation for looking at communities, whether it's a province, a community, or a neighborhood. We need to include all dimensions of diversity, what is seen and unseen. For example, we may consider physical mobility disabilities, which is a more visible disability, in our neighborhood and community planning by providing ramps up to street curbs. But we might not consider the loss of vision, hearing, or mental health. Different kinds of diversity interact. Barriers to inclusion experienced within one dimension, for example, gender, interact with those experienced by others, for example, ethnicity, thus creating complex individual experiences. Diversity is indeed complex and multifaceted, but overlapping experience need not make it difficult to create strategies to help or eliminate barriers. For example, a good public transportation system within and between major cities would not only increase city access for lower income families, but improve the quality of life of people with disabilities and medical conditions, new Canadians, seniors, youth, and post-secondary students. Newfoundland has come a long way, but it still needs to do much more to ensure awareness and acceptance of diversity. Exclusionary and marginalizing practices in our communities are associated with othering. Othering is the process of marginalization that occurs when those thought to be different from are taken for granted notions about ourselves are devalued, and individual differences are rejected. Promoting positive societal attitudes on inclusion is thus as important as ensuring individuals' built environments and policies. Public education and campaigns should be provided to various levels, like employer, employee, educator, and learner, different age groups, children, youth, adults, and seniors, and different environments, school, workforce, and community. And these public education campaigns then would increase awareness and acceptance of diversity and dignified inclusion. So there's various ways and strategies that we can focus on community-based planning and collaboration in order to increase inclusion within our province. Communities are the ultimate beneficiaries and key stakeholders in inclusive practices. A community-based approach based on the perspectives of individuals, groups, and communities in Newfoundland and Labrador will provide more meaningful, socially and culturally appropriate and sustainable strategies to reach our vision of an inclusive Newfoundland and Labrador. We need to have knowledge exchange, and this is an iterative process of joint decision making and problem solving between expert practitioner and communities. It should occur during the entire processes of planning, implementing, evaluating, and maintaining inclusive practices in Newfoundland. We also need to have a facilitative approach, a bottom-up approach. Often we're using expert and practitioner-driven approaches, and they're perceived as paternalistic, irrelevant, manipulative, and even invasive. We can have a tendency to take an expert role rather than this more facilitative role in planning. But a bottom-up rather than top-down approach works best, is more sustainable, and lends to a happier and healthier provincial community. Community-based, interdisciplinary, and intersectorial collaboration and partnerships are essential. We can achieve a vision of inclusion or of an inclusive, healthy, and livable province unless we learn about each other and our different perspectives, communicate with each other, and work together. Partnerships and collaboration are essential to success, and we have to remember that partners also include individuals and local citizens. To achieve our vision of an inclusive Newfoundland, an ecological approach, which is also called a systems approach, is required, as individual Newfoundlanders and Labradorians are a part of a greater system. In order to be inclusive at the provincial level, you must consider the whole system of influence. We also need to consider the whole person when being inclusive. Travel, education, health, work, social participation and social capital, and the built and natural environments. Community development and planning often focus on one of these aspects of the system. However, we need to address them all and understand how they are interconnected and related to each other. For example, providing affordable daycare options to a single mother so that she can seek employment is not effective if she cannot access transportation to the daycare or her place of employment. So my colleagues and I have developed various goals and priorities for Newfoundland, and I realize I did not include them all here. There's supposed to be a list. But the first one is that we need to speak with people. In order to achieve an inclusive Newfoundland and Labrador, is important for government, social and health services, education departments, and employers to learn about issues of inclusion by speaking to affiliated dimensions of diversity groups. For example, Empower, Coalition for Persons with Disability, First Light NL, St. John's Pride, LGBTQ+ Society at Memorial, Association for New Canadians. A specific recommendation is for government to build networks and partnerships with these not-for-profit organizations to involve them in decision-making processes. We also recommend that the province employ a community-based participatory approach to universal design planning. Universal design practices would increase if planners and architects would communicate with people with disability and minority communities in order to better understand what is needed to meet universal design goals. We also recommend that Newfoundland and Labrador education provide education in universal design to employers and public administrators, city planners, and architects. Sorry, I realized I said the first 2 points there before I was supposed to. But we also recommend that they revise the building codes to remove these optional accessibility guidelines, and that they ensure members of the disability community and other dimensions of diversity are invited to provide input into these revised building codes. We need to apply universal design to future constructions as well as major renovations, beginning with all government-funded constructions. We need to establish a subcommittee within government to evaluate public building accessibility compliance and budget for remedial actions to achieve full compliance. And finally, we need to implement universal design legislation or regulations to provide incentives to encourage its use. Incentives such as tax rebates for universal design, construction, and expenses. We also need to address accessible and inclusive transportation. Our transportation system, our roads, public transportation, sidewalks, and bike lanes connect us. It connects us to family, friends, jobs, recreation, medical, and social services. An inclusive transportation then gives people of all ages, abilities, and from all communities, whether urban or rural, the chance to fully participate in all aspects of public life. It can be difficult, for example, for grandparents to take their grandkid to the park for those with limited sight to follow signage, or for people to feel safe walking at night, or people to use wheelchairs to get to work. Unfortunately, our transportation system is mostly designed for cars and does not provide fast, reliable services for all ages. An inclusive transportation system then starts with pedestrians at the center of design. The details of how a city is designed for pedestrians of all ages and abilities is crucially important, and these details are the building blocks of an inclusive transportation system. An inclusive transportation system means that all people can afford public transportation, and there is a system in place to ensure transit affordability is sustainable over time. An inclusive system also means having great signage for people walking, riding bikes, or using public transportation. This lets people know where they are and means they can easily identify landmarks and transit stops. And worldwide, there are a number of different inclusive city initiatives. For example, the 8 to 80 movement and the World Health Organization age-friendly cities. These are important examples. We also have to focus on inclusive natural and outdoor environments. The benefits of inclusive outdoor and natural settings include, but are not limited to, increased experiences of and appreciation of nature, enhanced opportunities for satisfying and enjoyable leisure in outdoor settings, enhanced health and well-being, increased physical activity levels, enhanced independence in the outdoor environment, increased cognitive, social, and creative abilities, and increased friendships and support networks, as well as augmented outdoor skill development and increased understanding of requirements for outdoor inclusivity and accessibility. But to achieve an inclusive natural and outdoor environment, we need, at the very least, to utilize surfaces, slopes, and lighting on trail networks so they may be safely used by all. We need to allow wheelchairs, manual or power, and manually powered mobility aids like crutches, anywhere the foot traffic is allowed on trails and paths. We need to provide frequent rest, shelter, and return options on trail networks. Provide signage and information in a variety of accessible formats and technologies. It'd be great if we could provide a lending library of outdoor clothing and outdoor accessibility aids and devices so that users may access conveniently and affordably. And we need to ensure that user fees are kept affordable and not a barrier to participation. It is also important that we hire a diverse and inclusive staff to work in outdoor and natural settings, and also use diverse and inclusive marketing images in order to explain to people that they can belong too, they are included. And finally, we need to offer integrated and inclusive community outdoor programming. The province has made progress to inclusive education over the past several decades. There are improvements to be made, though, in terms of creating an accessible and affordable education system throughout the entire province. Specific recommendations include reviewing key performance indicators for the system to determine if the goals for all students have been achieved, have achieved the intended outcomes. We need to create support systems for teachers, students, and families. And we also need to revise our curriculum for pre-service teacher education programs. And also provide professional development opportunities for in-service teachers around issues of inclusion. We also need to work towards incorporating inclusive sport and recreation programs into the school curriculum, rather than what we do now, which is we're leaving it as the best efforts or teacher discretion approach, which is not inclusive. And we should be conducting a needs assessment and evaluation of inclusive practices within post-secondary institutions in the province. Forecasts indicate that our province will have almost 64,000 job openings by 2025. Yet our population, from which most of our labor force is drawn, will decrease by more than 30,000. As a result, migration and other labor supply responses, such as higher participation rates, will be required to balance demand and supply. There is a real opportunity for individuals from diverse communities, including people with disabilities, to be more actively engaged in the labor market and contribute to the business success of our province. Increasing the labor market participation of candidates from diverse backgrounds in Newfoundland and Labrador is key not only to further enhancing full inclusion, but is also essential in meeting the labor market needs of the province today and in future years. An inclusive employment culture would include full and successful integration of diverse people into a workplace or industry. While an inclusive culture certainly encompasses a commitment to workplace diversity, it is not limited simply to basic representation. Rather, an inclusive culture indicates a climate in which respect, equity, and positive recognition of differences are all cultivated, and the social and institutional response to differences, like sex, gender, or disability, pose no barrier to a positive employment experience. Therefore, an inclusive employment culture includes an articulated goal, an outline of objectives, and annual targets to be met, identification of the industry sectors that would be targeted to increase the employment of minorities and persons with disabilities, and an outline of engagement strategy involving employers and their representative organizations. In order to achieve this, we really need a widespread public awareness campaign to promote the multiple business benefits of inclusive hiring in partnership with other inclusive employment programs. Such a campaign can be built around a theme of successful employer-employee matches that highlight the success businesses achieve through inclusive recruitment. It is also necessary to educate employers about the economic and business benefits of multicultural and inclusive hiring to the labor market. And this is going to require financial support to businesses to increase workplace modifications and employee adjustments. More inclusive hiring practices are needed, and creating websites and electronic recruitment processes that are accessible to all candidates seeking employment. And we also need professional training to build disability confidence and integrate employees with disabilities in the workplace. As such, workplaces need to have physical accessibility. We need single person and non-gendered bathrooms. Communication accessibility, which that's like also alternate formats to work materials, braille, audio, large print. We need adaptive technology and website and mobile app accessibility. And finally, equal access to work activities as well as emergency preparedness. The majority of health services in Newfoundland are located in St. John's. Residents living outside of the metro area have to travel to access specialized care. Further, many small communities in the province have difficulties recruiting and retaining medical professionals. And this is same in St. John's. There are also a number of barriers to healthcare. For example, it is challenging to identify family physicians taking new patients, so many people are forced to rely on an already overburdened emergency care system. Health policies are needed, that build on equity so that those who are most vulnerable and marginalized have access to needed health care. Specific recommendations to improve inclusive health and healthcare include improving health literacy of all citizens so that they may be better equipped to manage their health and their health of their dependents. utilizing all possible technologies to improve access to healthcare services and reduce the barriers related to transportation, and developing a public policy that addresses the social determinants of health. For example, medical professions who are educated about social determinants of health, so they may be more sensitive to the experience of those who are vulnerable and marginalized. We also need the implementation of health promotion and prevention strategies. For example, falls prevention strategy to reduce the complications and associated costs stemming from falls in older adults. And we have to ensure that we give a voice to marginalized groups and include them in all decisions relating to healthcare services. Access to quality healthcare is a right for all Newfoundlanders and Labradorians. However, due to the distribution of health resources in Newfoundland and Labrador, we see that not all citizens, in fact, have adequate access to healthcare. There are a number of reasons for these inequities, but it is crucial that we address these issues to ensure all residents have equitable access. All too often, those who need access the most face the most difficulties. So while a vision of an inclusive Newfoundland and Labrador may seem like a dream, I hope that I've provided you with some real tangible ways in which we can fulfill this vision. And I want you to know, like in community development and recreation services and therapeutic rec services, this course, you're going to be the next generation that is making change in Newfoundland. And I hope that, no matter what your job is, that you're going to be able to take this information and help us to improve inclusion within our province.